leave the industry after many generations because agricultural policy had changed in the US. And I was frustrated as a chef by the quality of food that was in the conventional supply chain. So I would seek out farmers. Marna may remember when we used to drive up to New Milford, Connecticut to get our pig eggs and other things, so that we could just give and provide the best possible food for our customers. But it was during that journey that our firstborn son, Chris, at age 5, was diagnosed with type 1 diabetes. And I had made all kinds of connections between, food and, supply chain inequities, food and quality, deliciousness, equity to markets for farmers. But I really had never made the connection between food and human health. I always ate well growing up, even though my family struggled with poverty, because we visited my grandfather's farm in the summer and we grew a lot of our own vegetables, but a connection until Chris was diagnosed. And that just led to a journey over a few years of me realizing I was feeding tens of thousands of people a year. The more I learned about what I needed to do with our food strategy to give Chris his best shot at a long-term outcome, wasn't reconciling with some of the ingredients I was using in my restaurant. So I changed concepts, and in 1997, opened a restaurant in the first hotel called Heartbeat. It was a restaurant of well-being, local, organic, sustainable, no processed food of any kind, because at the time we were still under that science of assumption that fat made you fat, cholesterol gave you high cholesterol. We've learned that's not true. But we had no butter, no cream, no flour, no sugar, and had to still make things delicious and make sauce and dessert. And we figured it out. We got 3 stars in the New York Times and 0 stars in the New York Post, and got accused of being the food police. So we were controversial and busy. That led me to getting invited to a variety of think tanks where I learned about this thing called the social determinants of health, which I was just foreign thinking to me, or the impending diet-related disease crisis. The obesity epidemic was just in its beginning. And that's where I learned about the family of 4 that runs out of food stamps in the middle of the month and has $2 for dinner for all 4 people. There's no business model for that. I was able to change what I could do, going from my days at restaurants like the Fleur de Lis and Mich and converting to Heartbeat, because I had a customer base that, if the food was delicious, could afford the $30 per entree to get a cuisine of well-being. There is no such business model for that. So that's the energy that led to Wholesome Wave. It was that thing similar to Chris's illness and not being able to feed my customers something I wouldn't feed my family, not being able to figure out what to do about these families with $2 for dinner is something that I just felt couldn't stand, and I couldn't sleep at night knowing that it existed and not doing something about it. That led to the founding of Wholesome Wave.
And what year was that?
2007.
2007.
And I did that in partnership. I'm actually the co-founder of Wholesome Wave. My co-founder is the late actor, the late Undersecretary of Agriculture, Gus Schumacher. And we were really partners in crime in this whole thing. He's a former EA official and really kind of brilliant guy. In the policy world, he was kind of like a celebrity chef in the policy world. Pretty cool. Wonderful human.
And Ben, welcome. Thanks for joining us today. We'd love to hear about your interest in this business model and how you got to know Michel and how you are here today.
Yeah, well, great. Thank you for having me. It's an honor to be here. So I came here, actually, I met Michel because, as fate would have it, a dear friend of mine who I went to seminary with, he and I remained friends, and he had mentioned Michel's work, mentioned Wholesome Wave, and said, this is something you might want to consider. And at the time, my career, I've been in public health for a little over 20 years. First started in HIV/AIDS, particularly around community engagement, clinical trials research, HIV prevention work. through that work, got really interested in sort of asking the question, why is this happening in certain populations? And that really began my interest in the issue of equity, and seeing that what we were seeing in terms of who was getting infected told a story about access and lack of access. And as a result, I got really passionate about equity, and then had an opportunity about 6 or 7 years ago to move into another disease, heart disease. And obviously much bigger pond, lots more people have cardiovascular disease, die of cardiovascular disease. But interestingly enough, the same question about equity and access was there. And looking at who is most impacted by heart disease, why are they impacted by heart disease? And most recently, certainly with COVID, which really blew the lid off of a lot of things that folks in public health have always known, namely that the populations most impacted by these diseases don't have access to basic necessities, food, employment, all those sorts of things. Food, obviously, at the Heart Association is a big issue. And in fact, in this past year with COVID, they made a conscious choice to focus on, to have one of the pillars of focus be nutrition security. And of course, by that time, I had already been very interested in nutrition security as an issue, because that's what we were hearing in Boston in terms of one of the big issues facing communities here, and especially in COVID. And so the opportunity to move to an organization, first of all, as Michel has talked about, has this amazing history in terms of policy, whether it's veggie prescription programs, SNAP doubling, those sorts of things, to see the impact it's had. And to be part of that story, to me, was really an exciting opportunity. And so I decided to take it, and really glad to be here.
Thanks, Ben. I'm just reading through the about section on your website, and the SNAP doubling program has got me hooked. I mean, it talk about applying leverage to a pre-existing public program that that is geared to healthy nutritional products. It's such a great design. Tell us a little bit about how you got there and how it works, and how you are going to judge its success.
Sure. So, the interesting thing for me at the time when I was introduced to Gus, the thing that caught my attention was the $2 for dinner for 4 people. And so I thought it was an affordability issue. I also at the time thought that it was an education issue. It's a very popular notion for people to think that people struggling with low income are making poor choices because they don't have the information to make good choices. And I like to look at it as, if you live in rural Alabama and you need a vehicle and you have $450, and there's a Mercedes dealership on one side of the road, and on the other side of the road there's a dealership, and they an old 30-year-old used Chevy with 300,000 miles that's available for $450. Of course, a healthier, safer decision for you would be to buy the Mercedes, but you're going to buy the truck because that's what you can afford. And that's what's I learned was going on in the food system. And Gus was just such a good partner in that, because he really understood the underpinnings of the policies that existed that kind of perpetuated that reality. When we look at, the price supports over the decades that really arose out of national security after we went through 2 world wars. We were convinced there would be a third. So we were all in on, how do we grow, manufacture, stockpile, preserve food so that we can survive that next global conflict. That entire infrastructure was built largely on public dollars. So there's this time with this fear of warfare that the public sector, the private sector, the general electorate, all all kind of came together and said, yep, this is what we need, not knowing what would happen with all those highly processed carbohydrates. So I just, when Gus and I got together, there was a big movement and it was coming from the public health field to consider restricting SNAP benefits to only be eligible for healthy food choices, which I felt would be disastrous because I come from Chicago, and on the west side of Chicago, there's a place called North Lawndale. It's one of the poorest, most violent communities on the west side of Chicago. And in 60 square blocks, the only place you can buy food is at a liquor store. I mean, they have Hamburger Helper on the shelf. They have no hamburger in the display case because nobody can afford it, but it's sitting right next to the condensed soup, and they have recipe cards for Hamburger Helper with condensed soup, so you can get a meatless pasta meal for 6 people. My thought was, rather than put people in a position where they can't afford any food, why don't we just double the value of good food? Why don't we do a 2-for-1 sale? And I knew from my recent learnings about, diabetes, type 1 or type 2, that one of the best decisions you can make immediately is significantly increase your consumption of fresh fruits and vegetables, because of the phytochemical micronutrients, but more importantly, the fiber, and how that mitigates the impact of so many other things that you eat on your metabolic health, et cetera. So we decided to do a 2-for-1 fruit and vegetable sale, and it was illegal. We basically raised private money and said, we got this private money, we can do whatever we want with it. Hey, if you have food stamps and you come over here to this farmer's market and you buy fruits and vegetables, we'll give you 2-for-1. Gus fixed that for us. That was a lot of our early advocacy, but that's how the idea came about. It's like, you're not going to get someone to change your behavior by trying to force them to buy something they can't afford. In fact, that's unintended, cruel, and unusual punishment. And if you're going to be successful helping people embrace a healthier lifestyle, you have to make it fun and easy for them to do, and they have to be able to afford it. So it was just an idea that we were lucky to have at the right time that really caught on.
And what sort of scale does it operate on? I mean, it's a federal program. It delivered and administered evenly across the US, or are there particular areas that are more in need?
Yeah, it's it unfortunately, while we were successful, we got a $100 million pilot into the 2014 Farm Bill called the Food Insecurity Nutrition Incentive Program, and it requires a private sector match. So it was $200 million available over 5 years to double food stamps for fruits and vegetables during a time when there were about 55 million Americans relying on SNAP. So it just, you can't reach everybody. We were very excited in 2018 when it was increased to $250 million, which made it permanent. It can't be debated on the floor of Congress. It can't be defunded in a government shutdown. With the private sector match that it requires, it's actually $500 million. But if you divide that amongst, and that's available over 5 years. So if you actually divide the 100 million that's available out amongst the 55 million or so now food insecurities, it's less than $5 a year for fruits and vegetables. So it can't reach everybody. So it's a grant program. Community-based organizations and nonprofits have to apply for it. To be clear, we didn't organize this legislation so Wholesome Wave could get it. We organized it so it could be available to the field. And it's called the Gus Schumacher Nutrition Incentive Program in honor of our late co-founder, Gus Schumacher. So we're very proud of that, but it's way too small. So when we look at, our advocacy challenges going into the future, it's, how does the field get that to increase to $1 billion, $2 billion and beyond, actually through, evidence-based research, which is going to be, one of the big opportunities for Ben to really put his shoulder into with his public health background to really prove that there will be savings to the system if we actually start to invest public dollars in health food and making it possible for people to eat more healthy food and be excited about it than waiting for them to get sick and paying for their medical treatment and the lost productivity that comes along with it. So it's really available based on people who apply, who can prove there's a demonstrated need in specific communities, but it's available now in all 50 states.
That's brilliant. So Ben, on day 5, you'll have it all figured out, right? It's such a simple problem to have.
5 o'clock today, actually.
Yeah, I'm going on vacation, by the way.
Well, Glenn, a question came through on the chat that might be great for Benjamin. It says, does Wholesome Wave have any plans for recommendations for small scale food growth, like out of pots on a front or back door?
Oh, like Urban Farming Institute. That's certainly something that I'm interested in and seeing if it's a possibility, because again, if equity is access, then there are ways that we can increase access, and partnering with a lot of these organizations that are doing the urban farming. I know in Boston, there's an Urban Farming Institute, and they have these grow boxes, and we were working with them to try and to support communities in getting access to those grow boxes. And it just seems like a really great way to engage people. Also, and this is something Michel talks about, is this idea that the relationship between us and food, that being connected to it somehow changes how we think about it. And that to me is something that's really exciting as well, to think that you have a connection to the food in a way that you didn't before. You see it grow, you nurture it. I think that changes something about how we take it in and health ultimately.
Yeah. I couldn't agree with Ben more. And I think the interesting thing about it is, a lot of people don't know this, but you can use food stamps to buy agricultural seeds and agricultural plants. So the economic impact of people embracing growing their own food and using their federal benefits to actually plant a tomato plant, if you look at the economics of just that example, a pound of field tomatoes, not heirloom tomatoes, just a pound of red field tomatoes is about $1.50. The price for a tomato plant is about $1.29, and you can get up to 20 pounds of tomatoes off of a tomato plant. So that the economics of growing your own food are pretty powerful there. And I do know that there are groups throughout the country that have taken the SNAP doubling concept and used it to help people double the size of their community garden plots.
So what do you see as the major barriers? I know there's a comment in the chat too, like Bill Maher is a big fan of food equity. I mean, we would certainly support your appearing on his show after this one, of course. But what are the barriers to equity, food equity in particular in this country? I mean, now you see cars lining up for miles, through COVID to get food stamp relief. So, and then I look at what's in the contents of those boxes, and it's not as green as we would have hoped. So, what's next?
Well,
yeah, you go first on that.
Yeah,
we'll ham and egg that, because we've got some great views on that.
The barriers you talk about, social determinants of health. That's a significant barrier, where people live, work, play, learn. The environment is a really sort of a frightful predictor of one's chances in life. And so the question is, how do the social determinants of health come into being? And there's a kind of journey upstream or root cause. And I see that one of Conscious Capitalism's sponsors or supporters is the Racial Equity Institute. And I've had the opportunity to do some work with them and participate in some of their trainings. And actually, we're doing their groundwater training on Monday. Our staff is, and I'm really excited about that. But certainly the idea in this case of structural racism and the history and legacy of racism in the United States and the impact that it's had on folks out of the slavery experience in terms of access to land, in terms of health, all of those things. You could certainly argue, and there's a lot of compelling data now in a way that there used to not be, about the impact on health and access and all of those things and health outcomes. And a lot of us see that in some profound ways. As Michel was talking about his own sort of personal story and having kids with type 2 diabetes, one of the stories I tell is just about my family and the fact that as someone who's 50 something, I am now the oldest living male with the last name Perkins in my family. Like all of my father and his two brothers all died in their 50s. Well, actually the last uncle was 65, but all cardiovascular diabetes related deaths. So that, there's a story there, certainly. And it just, when we talk about barriers and structures and those sorts of things, it's critical to pay attention to those, because to the extent that we don't, a lot of the work that we do is, as the Racial Equity Institute will talk about, fixing fish as opposed to addressing sort of the groundwater.
Yeah. And I think, just to reflect on that, when we kind of like the structural barriers that are there, within that context of structural racism or aversion for anybody that's low income, there's been, and this really started happening in earnest in the 80s because of the size of the government programs, and it came by big government movement. These are big programs when you have significant parts of the population that are living in opportunity deserts. They don't have the access or aren't allowed the access to the type of education or opportunities that would prevent them from being in poverty in the first place. The whole notion of the lazy taker and food stamps really not meaningfully increasing in its dollar value per person for decades. When we look at what you described, Glenn, the lines of cars at the food banks and the food banks being wildly overwhelmed, and you open the boxes and arguably there not a lot of healthy stuff in there, certainly not enough to constitute what would be a healthy diet. It's not the food bank's fault. It's just easiest for people to donate non-perishable stuff. Most non-perishable stuff tends to be a highly processed carbohydrate, which isn't great for you if you're trying to avoid obesity. And fruits and vegetables are perishable. Food banks have to buy those. Grocers, retail donate them because they paid for them. They need to sell it. Happy to sell something that they're going to throw away, but they also know isn't going to spoil for another 3 or 4 years because it's highly processed. So, that I just don't want people to think of food banks as peddlers of unhealth. They really have no choice. But the point is, when you see 10,000 cars in Austin, Texas, lined up to get food from a food bank, and you have an administration that refuses to rapid sign people up for SNAP benefits or food stamps. I mean, those 10,000 cars, if they immediately got emergency food stamps, could go to any of the 30,000 Austin area retail food stores, all of whom have big parking lots, walk in, buy the food that they need for their families, including fruits and vegetables and healthy food, have a choice in the matter, and not put over duress on this system that's really designed to feed people in an emergency. Food banks are supposed to be emergency feeding for direct very agencies. The factory left town, and now all of a sudden there's 150 families without work, and they don't know how they're going to put the next food on the table. Between the church and the food bank, we can help them. You know, that can't become the norm of how we deal with people that have, to Ben's point, that all of those broader other social determinants of health that are preventing them from being able to afford in our capitalist society to make healthy food choices and other life choices.
A couple of questions have come up in the chat. One about food waste and you know, the overabundance of food in certain parts of the supply chain, and kind of, you know, whether Wholesome Wave works to even that out in any way. And then use of public areas to grow food forests, community gardens, that kind of thing.
So Ben, I'll take the, and you can take the food forest, which I love the name. I love the sound of that.
That's the first time you're walking
through a forest of broccoli. I dig it. You know, on the food waste thing, we do have some programs that we incubated in Appalachia in rural America where it's called Practically Perfect, and we use that name because you know imperfect and ugly, and you know, it's just like, yeah, I love those causes, and they're great. They do great work and stuff like that. But you know, my mom always said, you know, some of the tastiest tomatoes were the ugliest tomatoes, right? So we it's practical and it's perfect. But you know, we set up some programs where local agricultural producers get a feed market. If they take a 30% discount off of what a regional retailer would have to pay them wholesale to get their perfect stuff, and then those retailers make a section in their grocery store available at a 30% discount to the customer. And then when we do our doubling programs and they can get two for the price of one, people who are eligible for SNAP and eligible for our programs get extra food for the dollar, but also are then introduced to knowing that they're a hero of a changed food system by going in there and choosing it, but they get more bang for their buck. But we don't work this there because there's so many things that Wholesome Wave could do. And we've decided that for now, and that could change, you know, with Ben's leadership, because he has some really great instinct, and we really have to start looking at this through a broader, scalable public health approach. But we do that the significant barrier to people making a healthy food choice is affordability. So whether it's by doubling food stamps or making it possible when they see their doctor and the doctor sees their weight towards type 2 diabetes, it's not too late. And instead of waiting for them to get sick and prescribing medicine that now Medicaid will cover, they can actually have medications and vegetables they need so they never get the type 2 diabetes. Fruits and veg way less expensive than dialysis. Ben, food forests.
Food forests. So what food forests? Tell me what's the definition of them?
My understanding of the question, Ben, would be use of public space, common areas in cities and towns for purpose of growing food, you know, where you might have edible plants mixed in with regular public parks.
Interesting. Okay. Well, you know, my answer to that, after just hearing the description, is that sounds like something that could certainly help. I know there's the community garden concept, and depending on which city you go to, some have more robust community garden systems than others. I know here in Boston, we have a pretty nice community garden system. But again, you know, if the issue, if we're talking about equity and access, any way that can be devised innovatively, creatively, that can increase access, I certainly would never dismiss, and I'm going to be really curious and see how what the potential for scaling that could be and replicability.
Yeah, and I think from a policy perspective, it's actually something to consider, because one of the things that's a barrier to the community gardening network is getting land that can be used extended periods of time. Cities and city city councils are happy to allow people to use unused space in public space, gardens, until a big developer comes along and offers a big project that's going to increase the tax, and the gardeners get kicked off and they have no place to grow. So I think when we look at municipal policy, to be able to set aside parklands and easements and other things and make them permanently available, provides a type of security to these groups that do this work, like Ron Findley, the gangster gardener in Los Angeles, who actually created the concept that you're talking about. So that can take hold. I am going to advise to everybody. I might have time to question, and Ben's going to take over, but I have to leave just a little bit early. But I just wanted to get at, if my screen goes blank, it's because I have a hard stop at 3:45. So I apologize in advance. Someone want to call out another question?
I was just going to make a comment that, one of the things we did in our business was we had a big lawn in front of one of the buildings. We plowed it all up about 2 acres and basically let the employees, we tilled it, we irrigated, we set up an irrigation system, we put a fence around it, and we had about 300 employees, about 60 of them signed up for a plot in the garden. And it was a great collaborative thing. People would meet each other who wouldn't normally bump into each other, share gardening tips, help each other out. People had never gardened before, get ideas from other people who did it, on a regular basis. And the other thing we did too is when there was, obviously, when you plant a bunch of tomatoes, all of a sudden you have way more tomatoes than you can possibly eat. So we set up a big basket and you put them in there, and the local food pantry picked them up. We had another section of the garden which was just for the local food pantry, about 25% of it, and we had local school group basically would help to take care of that, and that food went to the food pantry. So that was a lot of fun. It was just a thing that we did, and I'm sure that there's a ton of, there's lots of other businesses that have big lawns that they could just plow up. And if there was a little nervousness about, well, we're going to have people's, employees, friends and family come in there, and is that okay? And insurance and, all this, things people worry about. But, it would seem to me too that, some companies might be willing to do that and make that available if there were, just a couple little bits of legislation passed just to keep, so they wouldn't, get sued if somebody tripped and, landed on a, rake or something. While wandering around in the garden. The other thing that I was just thinking about too, from Benjamin's point of view, from the, what you almost want to do, it's not fair, but is focus a lot of the resources in like one area or two areas, like hit a city and hit it really hard, with lots of good nutritional value, track that over a few years, show how, this is the level, in this equivalent city with the equivalent sort of population, they were like this. Now this one's dropped down to this level of diabetes or whatever. And the only thing that we can think of that happened was we set up this program and, we did it. And how much money would we save across the entire United States if we did that? It's not fair to like not give it evenly to everybody, but it makes the point, it makes it clear, and it might help to get the legislation that's spread more evenly. This is just my thought.
Yeah, and I will leave it at this and then turn it over to Ben, because I know he's going to be able to riff off what you're talking about. We're attempting to do that in Los Angeles and then through the state of California right now. But what you described, really focusing heavy duty, going deep in one community over years to prove that it works, is impossible to find the philanthropic funding to do that. It just, we're looking at and programs distributing, close to $20 million over the 6 weeks to 32,000 families in this. This will give you an idea of the scale of the problem. And there are 9 million food insecure people in Los Angeles. And 20 million is enough to reach 32,000 for about a 2-month period of time. So just the intensity of it is there. And I think the role that the corporate sector can play in it, really starting to figure out how they start to make using their marketing force and their marketing dollars, getting behind a cause over a longitudinal time to prove that they're not just trying to buff their image or correct their karma. They're really trying to be a good corporate actor. We literally need thousands of decent sized companies to start doing that. And then you could see that type of regionalized deep dive over the extended period. It gives you that longitudinal data that could quantify probably the trillions of dollars that we would save in healthcare costs and lost productivity, which Ben is an expert at. So I apologize, but I'm going to leave you all there. I appreciate your interest. These questions are exceptional. Glenn, if you could get those to Ben and I afterwards, save the chat. We'd be happy to take a crack at answering stuff we weren't able to get to here today.
Thanks, Michelle.
Peace
so
out,
grateful for your time. Thank you.
Take care. Go get him, Ben.
I'll try my best.
Well, I'll just speak a question that's on my mind is what attracted you or made you most excited to, go for this position and walking in?
Well, one of the things that excited me was for the first time in 2 decades, I wasn't disease centric. It wasn't HIV, it wasn't cardiovascular disease. It was food. And who doesn't like food? And the idea too that food is so intimately connected, think about Maslow's hierarchy of needs, and that if people don't get the basic needs taken care of, they're more likely not to, actualize. They're more likely to engage in riskier behaviors that might lead to cardiovascular disease or HIV and those sorts of things. So I felt like it was a journey to go upstream. And also because Wholesome Wave is this organization that is smaller than the colossus that is the Heart Association. It's a lot more nimble and open to creativity and those sorts of things. And certainly really committed. Like the thing I really loved was the idea that it wasn't about food insecurity, it was about nutrition insecurity. So really to take it up, you talk about good, ethical, noble, heroic, the idea of it's not just giving people food, it's actually the recognition that human beings inherently have dignity and we want them to have nutritious food. And one thing that my bio probably doesn't say is that I'm also an ordained minister. So there's sort of this deep moral, ethical current that drives me in terms of the whole issue of equity and justice. So this is right in line with sort of my own personal philosophy in terms of what I hope to see in the world and how I can be part of the change I hope to see in the world, as a wise person once said.
Well, keep in mind that Watson Inc., the company that Gavin just mentioned, is in nearby West Haven, where I'm a resident. So I don't know, in terms of partnering communities and touching it around Bridgeport to experiment with different things, maybe there are some bright spots we can help you accelerate.
Absolutely.
So there was a question in the chat from Kerry, just talking about the farmers and the fact that through COVID, there's been a lack of hands to pick the produce, so to speak. Is there any kind of opportunity there to intervene with that or assist with that to pick the produce? Is that one of your public health strategies, or is that too technical?
Well, that's really specific. I mean, the supply chain is so vast, and at this point, I think we've got our lane more or less that we're in, which is not to say we will always be in that or we can't leverage resources to do other things. But right now, as Michel talked about, some of our biggest work is around activating the distribution of food around the CARES dollars, which is LA CARES piece. Let's Feed LA program is quite significant in its scope and scale. So those are the kinds of things right now. And also, I think one of the things that's really exciting about being involved in that and our work, our plans to expand in California, is that there are going to be lots of lessons learned, lots of data, lots of best practices that we can hopefully replicate. We will replicate because the beauty is we will have a lot of data, qualitative and quantitative, that talks about how to do this effectively, or how to better ourselves in the delivery of our work. So I'm looking forward to those learnings so that we can hopefully scale those up and find other partners who are willing to support us on this in this work.
Some of the work that we've been doing at Red Rock, which is my day job, has been in public health initiatives with Yale and Columbia and Tulane universities. And the one I'm thinking about was with Yale. It was a mental health campaign. And we were trying to articulate the cost of incarceration versus the cost of treatment, and present this as a like a business alternative to the current situation. Of course, the cost of incarceration was 89 times the cost of treatment, but it was difficult for the community sort of gatekeepers to understand that and respond to it in a way, because they're all operating in these different silos of public responsibility and accountability. I mean, as a public health specialist, is there any thoughts around how you can redesign it so there is more accountability as to where it counts?
So, I mean, essentially what you have described is the lament of anybody doing public health, which is, that old adage, an ounce of prevention is worth a pound of cure. And it seems so painfully obvious, yet clearly we have systems and structures set up that favor detention over prevention, a disease management system over a true healthcare system that is centered on keeping people from getting sick in the first place. And that, to crack that nut is certainly there's data, and increasingly we are awash in data about this, about the number of quality life years saved by treating people earlier or preventing disease and that sort of thing. There's so much data out there, and the question, it's a deeper question about what are the motivations that individuals and corporations have that prevent them from sort of seeing the data that suggests that by improving the lives of those on the margins, you benefit everyone. There's a great short video that the California Endowment put together called A Tale of Two Zip Codes. I encourage, if you've never seen it, see it. George Takei from Star Trek is the narrator. So if you hear this voice and you go, that voice sounds really familiar, it's George Takei. And it just tells the story of two women who live in these two towns. And it's a story about the social determinants of health and how they impact one's overall chances in life. And at the end of it, one of the things they talk about is the idea that in societies where there is greater inequality, everyone is sicker ultimately. So that even in societies that are supposedly wealthy like ours, that as inequality increases, everybody gets sicker. And we see this from a public health standpoint in things like our infant mortality data and all our life expectancy is for the first time in a long time is actually declining. And so the question is, is that enough to convince people? Is there like this idea that equity is, as Angela Glover Blackwell talks about, equity is the superior growth model, you know, and paying attention. If we truly believe that equity is a force and that it ultimately benefits everyone, and we see it in data, how do we convince others that that is in fact to act, to make that leap, to believe that an ounce of prevention is worth a pound of cure?
Question in the chat is regarding what's next, and I know, Ben, this is only day 4 on the job, so it's probably a little bit hard for you to answer. But you know, the Double Up SNAP program, and there are a couple of others on your website. But you know, if you've got a few years into the job, how do you see the redesign of this problem that we have?
So one of the things that I'm excited about in terms of the potential, the frontier, if you look at the food space, you look at the players in food access, for the most part, they haven't really changed. You know, you've got philanthropy, you've got government programs, you've got school, I think the school nutrition program, which 1946, I think it came into being. So the sort of the key players haven't changed in 70 some years. However, what is exciting now is with the advent of the accountable care organization and value-based care, which is all around sort of the triple aims, which are to increase healthcare outcomes, decrease costs, and increase patient experience. These accountable care organizations are being reimbursed based on the health of a population. So they've got an incentive to have a healthier population now in a way that they didn't before. And so what it means is that they are now paying attention to the social determinants of health in a way that they never have before. And so what that looks like concretely for folks like, or organizations like Wholesome Wave and other folks who are in the food and nutrition security space, is that they are doing things like housing screens, social or food insecurity screens. Because what they know is that if you are housing insecure or food insecure, guess what? You're going to be less likely to be medically adherent. Your health outcomes are going to be poorer. You're not going to, you know, your hypertension is going to be poorly managed. Your diabetes is going to be poorly managed. And so what's happening now is they are actually writing food prescriptions for their patients, taking funds. There's some Medicare waivers in Massachusetts. There's a chunk of money that Medicaid is waiving so that they can use that money to sort of do a proof of concept around writing fruit and vegetable prescriptions. And this is something that I think we're going to see a lot more of. And so what it means now is that there's a new player in the food and nutrition security space that hasn't been there before. And so I think that is one of the most exciting developments, not the only development, but I think it's the one really to watch. And a lot of people think it's going to be the game changer. And we have in Boston, we have Boston Medical Center, we have partners that all have some version of this program that they're now undertaking. So just a preview of coming attractions.
We'll watch that space, Ben. Thank you. Any other questions before we wrap up? There's so much to cover. I mean, yeah.
Final, it doesn't, the time we have left does not do this justice, but where so many communities are passing resolutions declaring systemic racism to be a public health crisis, this seems to fit right in. And I don't know if you have any, you know, templates or supportive guides around that kind of connection between food and that.
Yeah, I mean, so it's an incredibly exciting development. It seems like it's really popped corn this year in particular, but each municipality is doing it a little differently. I don't think there's like a standard template for them. I know that part of what, for instance, in Boston, they're doing is they're convening this, some of the key players, the different sectors, to have a conversation about the role that they can play in whatever plan actually gets rolled out. So in Boston, a big part of the plan is around data, and they're going to be mandating that the hospitals submit data because they want to measure impact of whatever it is that is being done as part of the public health emergency effort. But my hope is, and I know the chief of health and human services certainly here in Boston. I'm going to be curious to see where food fits in, because there is an Office of Food Access. So they're certainly part of the city structure. The question is what that's going to look like. But certainly there's a place for the conversation about food. And there are different, depending on where you go, folks are framing this as food apartheid. So that's a racial justice lens being applied to the whole food and nutrition security space. It's not enough to say it's food, or call it it's not enough to say it's a food desert or food swamp. This is really the product of a system of apartheid, or a caste system, as Isabel Wilkerson has beautifully argued in her book.
Thanks for putting it in those terms. A lot of the community right around us are dealing with that. So turning it over to you, Glenn.
Thank you. And food apartheid is a very strong finish, Ben, but it does underscore the size of the problem and the scope of the solution. So listen, day 4 of the job, we're so grateful for your generosity with your time. I know you've got so many other demands given the size of the challenge that you have ahead of you. And even though this was a small group here today, it's still profound in the effect of the work that you're doing. So I'm very grateful for that. And just before we wrap up, because I do want to be mindful of people's time, a quick heads up that next week's guest is a young lady by the name of Sena Waza. She was one of our guests at the Climate Action Summit that we did in October. She's going to come back and talk a little bit more detail about all the fun work that she's doing on Sunrise, Connecticut, and a few other nonprofits that she's working on. So that will be a very interesting session. And as part of our Young Mentors group, we're really excited to have these bright young minds to come and teach us a thing or two. So Ben, again, thank you so much for coming. I will send the chat session to you both as a way of getting to questions that didn't get to today. And always good. I love these gatherings, and have a good Friday. Thank you so much.
Thanks. Be well, everyone. Thanks again.
Thank you.
Bye-bye.
Good luck.
Thanks.
Thank you.